Okay, I think it's recording. Hi, guys. I am back for Module 7. So we have gotten through Modules 1 through 6 so far in NHA, and now we're at Module 7. So I am going to share with you a presentation and kind of go through a couple of things, too, that you will see when you go through the module itself. I will say this is a pretty important one, and it's a little bit dry. There's a lot of information that you probably haven't heard a lot about. Um, because, and even when you start your externship, you won't have heard a lot of this stuff too, because most of you are working or doing your externship at a community pharmacy. So there's some different pharmacies out there. We talked about that at the very beginning of school. You've got your community pharmacy like Walgreens, CVS, any of those places that are in one of those grocery stores, something like that, like Costco. All of those are considered community pharmacies because the people can come and pick up their medications. And most of it is pills. They don't do a lot of compounding. So remember we talked about compounding is when they actually make the medication however it needs to be made, whether that be a liquid or an IV or whatever. So in compounding pharmacies, whether that's in the hospital or a private pharmacy, you're going to have some different ways of doing things. So in the hospital pharmacy and also in a compounding pharmacy, things are going to be done more sterilely, especially if it is put in an IV bag, because an IV bag is going to go straight into the patient's IV, into their body, into their bloodstream. And so when you're taking a pill, it's not super important that something is sterile because and most of the time it is. You're still, usually wearing gloves, you're being really careful, but it doesn't have to actually be completely sterile because your stomach acid will kill bacteria if it gets on there. But that's not the case with an IV. And that's why they make it a really big deal out of compounding and sterile compounding and all of that. So that's what we're going to talk about today. So I'm going to present my screen and open up the PowerPoint first. Okay. Okay, so hopefully you guys can see this. Let's see. Slideshow. Okay. So, some reviews of Chapter 7, Part 1 are key things to remember. So, these are a few terms that they use at the very beginning of Chapter 7 that they kind of want you to understand. And you may have heard these before. We talked about this in health science actually last year, which was standard precautions. And it's an important approach to infection control that treats all bodily fluids as if they were infected with diseases. Infection control, which is actually in the definition of standard precautions. So if you're wondering what's infection control, well, they are measures practiced by the healthcare professional, that's a HCP, in a healthcare facility, which is HCF, to decrease transmission and acquisition of infectious agents. So that could be a bunch of different things, wearing PPE, garbing, or right underneath there it says garbing is the process of donning or putting on PPE. Could be an infection control method. Aseptic technique is also an infection control method. Obviously wearing masks, glasses, all of those things, wearing shoe covers, lots of different things can be infection control measures. Washing your hands can be an infection control measure. So we talked about garbing, putting on PPE or personal protective equipment, and then aseptic technique, which is a series of steps or precautions used to decrease the chance of contamination during the sterile compounding preparation. So that's when you're actually making a sterile product. Again, sometimes you'll make something that's not necessarily sterile. For example, one example that they would use is magic mouthwash. And it's actually a mouthwash that some dentists prescribe. And it numbs the patient's mouth. And it's for people who have, especially like cancer patients who can get mouth sores really easily. They can use that to kind of help with the pain of the mouth sores if they're going through cancer treatment and things like that. But that doesn't necessarily have to be sterile because they're actually putting it in their mouth, they're swishing it around, they're spitting it out. They don't actually swallow it. So that's one way or one thing that you might see made in the pharmacy that is not sterile. But like I said before, if you make anything that's going to be injected into the patient, so a injection, a shot, a IV bag, all of those things have to be completely sterile because of infection getting to the patient. Because if they were to get some kind of a virus or infection that went straight to their bloodstream, they could get really, really sick and actually die of a secondary infection even in the hospital. So, and then a lot of times they don't even realize or know where that infection came from, but they found out through a lot of research that sometimes it can be linked back to not using proper aseptic technique and infection control in the pharmacy, whoever's making that IV bag. All right, so PPE is used to protect both the healthcare provider and the patient. So PPE is for both you and the patient. Okay, so hand washing should be a minimum of 30 seconds. In the book, I think there's actually in the in your quiz at the end of chapter 7, I think one of the questions was like, how long should hand washing be? And they teach you in the module that it should be 30 seconds. But the answer is like 20 to 30 seconds in the quiz. So just an FYI on that. It's the best infection control method. Hopefully we all know that from COVID and learning different infection control techniques. I think everybody learned a lot. So hopefully you know that. Hands are washed with povidone iodine. I always say that wrong. Povidone iodine, triclosan, chlorhexidine gluconate, or chlorhexanol. And that is a test question. They want to know what you would use to wash your hands. And they give you examples. You can use hand sanitizer like alcohol-based hand rubs, but only if there's no visible soiling on your hands in between garbing or after touching something potentially contaminating like adjusting your glasses. OSHA requires employers to offer hepatitis B, that should be HEP, hepatitis B vaccines to all healthcare provider workers that are at risk of contracting disease due to work conditions. So that is another test question. And you'll notice, you guys, that I actually put a lot of test questions in here. Sorry, I feel like I'm losing my voice, you guys. You might be hearing me like clearing my throat a lot or drinking water. I might be losing my voice. I don't know. So you might hear me saying, like, what I put in this PowerPoint is a lot of test questions. Okay, so you're going to perform garbing in the anteroom. And I have another quick PowerPoint that I'll show that kind of shows you like what the anteroom is. But there are different rooms that they have when you are doing sterile compounding. And they have one specific room for putting on the PPE, and that's going to be the anteroom. And that is a test question. They also have a test question about how to put on PPE and what you should put on first and last. So it's kind of, if you think about it, like it's from dirtiest to cleanest because you're going to wash your hands in between. So you will put shoe covers on first because that's the dirtiest, and then go all the way to gloves at the very last. So gloves, right before you put your gloves on, that's when you would wash your hands again and put the gloves on. DCA, or the direct compounding area, is 6 inches inside the primary engineering control where compounding takes place. This means that when you're working and you have all your stuff out and you're sitting there, you know, making this drug, you have a little 6-inch space with your hands, and that is going to be your direct compounding area. That area is like sacred. It is like the place that you want everything to be extremely clean, no contamination, nothing. And so that you kind of have to think about it like that. It's like the extreme clean area where your hands are going to be working. And that's a test question as well. You should remove PPE in the reverse order of how you put it on. So that means you would take your gloves off first, and then you would take your shoe covers off last. One question, or a couple questions that they have, but they don't really go into depth about, is media fill testing and glove fingertip monitoring. You probably saw that actually in your first, there's some questions on it in your first practice test, the 100-question one. And what it is basically making sure the area and PPE you use are sterile. And so if you fail, it's like a quality assurance test. So you're just doing these little tests to see, like, okay, if I do this and we test it, is it going to still be sterile? And if it fails and it comes back that it's, that it's not sterile, that means a contaminated product, which is bad. So that's something that they're going to want you to know. Okay. And the module actually goes more in depth, by the way. Okay, so remember USP 797 describes the frequency for cleaning and disinfecting sterile products. Remember, we talked about, I think it was in the 5th module, what USP 797 was, and that it talked about sterile compounding, so you need to remember that. So again, some quality assurance tests. You've got the media fill test, and the low risk you just need to do once a year. Medium risk is at least 1 time per year, and then high risk is twice a year. So they want you to do it that many times in the year, depending on the risk level. So like highest risk level would be like you might have some non-sterile products that get mixed in from time to time. Like there's some things that you have to make that are non-sterile that you have to add to a sterile product, and that's a high risk. Or if there's multiple steps, like if you have to add multiple medications, even if it's all sterile, there's like a lot more steps to it. It makes the situation more high risk because there's just a higher risk of contamination. Okay, so for disinfecting compounding areas, the laminar flow hood or barrier isolators, you're going to disinfect at the beginning of each shift before each batch prep, so before you make any medication, and every 30 minutes during continuous compounding. So say you're making the same medication for like 4 hours, you would just have to re-disinfect everything every 30 minutes. Now, if you're making different medications every time, then you would have to, that means it's a different batch prep. So you'd have to you'd have to completely disinfect before you did that every single time because you don't want to contaminate and mix medications. You're going to disinfect counters, work surfaces, and floors daily. So yeah, they do have to completely clean the floors daily in those areas. And then, oh, sorry guys, I just had lunch. And then walls, storage bins, and ceilings are cleaned monthly. Don't ask me how they do this. I don't know. Every year I talk to my students about this, and I'm just like, has anyone seen this in an actual pharmacy? Because a couple of my students worked at every year they usually work at a compounding pharmacy, and I'm just like, when do they clean the walls and the ceilings? Because it's monthly, like still pretty frequently. So I don't know if they like have crews come in or what to clean, but yeah, so that has to be cleaned monthly. And these are test questions. They'll usually ask you, like, how often do counters need to be cleaned daily? Or how often do counters have to be cleaned? And the answer would be daily. How many, how long or how often does the laminar flow hood have to be cleaned? And it'd be like any of these answers here. Okay, so you will be doing the vocab. It's going to look a little different, though. It's not going to be in a book. It's going to be in your module. I want you to go through the module and find the vocab. It's there. You have to just go through and look. Let me see if I can show you guys real quick. Sorry. Yes, I know I'm presenting to everyone. Oh, man. I thought I had it up, but maybe it clicked out. Let's see. It is. Hi. Hold on just a second, you guys. I'm doing a video right now. Thank you. So you're going to, I'm going to show you what I see here, but you're probably going to see it too. So if I'm previewing module 7, preview, it should show me what it looks like to you guys. So let's see. So yeah, as you go through here, you're going to see some bolded things here. And then I think it's under, I saw it earlier. It's actually under sterile compounding here. So right here, you're going to see these, what's it called? These key terms. So I want you to do these key terms and type them in, and you're going to upload this. Okay, so you're going to have to go through. There's not that many, but you do need to go through them and make sure you know them. Okay, let me find. Well, I've lost my PowerPoint now. Sorry, you guys. Okay, wait. That was the one I was going to show y'all later. Do I want to show you this one? Okay, here we go. So, this is the vocab you're going to need to know, and there's more here. All of these things you're going to need to know what they do and what they are. USP chapters to know. Oh, you know what? Go back to, there we go. You're going to need to know 797 are guidelines for sterile compounding. 795 is guidelines for non-sterile compounding. So remember I told you sometimes you might make something that's not sterile. It's just that you're making it in a clean environment, but it's not imperative that it's actually 100% sterile. So there's that. And then that's 795. And then 800 are guidelines for handling and compounding hazardous drugs. USP 800 is more for you as the healthcare worker or as the pharmacy tech, because when you handle hazardous drugs, the person that's most exposed and the most vulnerable would be you making that drug. For example, chemotherapy drugs. Chemotherapy drugs, they come in a powder, okay? They start off in a powder. They are made into a liquid and put in usually an IV bag. The powder is extremely hazardous to breathe in. It can cause a lot of, they can cause lung damage. It can cause a lot of things, hazardous things to your health, like overall in your body. And so, I mean, if you've probably heard like people say cancer drugs are, I mean, they're like, they make the cancer patient feel horrible, you know, but they're getting an exact dose. But what if you are exposed to that at a different level? So you have to be really careful. So chapter 800 talks about how to go about handling and compounding those hazardous drugs, and that's very important for you. Storage temperatures to know. They do want you to know these temperatures. Freezers are -20 to -10 degrees Celsius. Protecting from freezing is above 0 degrees Celsius. Refrigerator setting is 2 to 8 degrees Celsius. I think that was the question that was asked last year. One of my students was like, oh, they ask about refrigeration settings. It's 2 to 8 degrees Celsius. Controlled room temperature is 15 to 30 degrees Celsius. And excessive heat is above 30 degrees. They might ask a question too, like, what happens if the power goes out and we have medication in a refrigerator and you notice that it's at 28 degrees Celsius. Is it still okay to use this medication? And if the medication like has to be like it'd be like, is it okay to, like, what would be excessive heat? Is 28 degrees excessive heat? And you'd say yes or no. So you kind of have to know these temperatures because they'll ask you like a scenario type of question. Also, they will ask you some in Celsius and some in Fahrenheit. So you need to remember back to module 6 when we talked about going between degrees, going to between temperatures, going between the different what's it called? Degrees Celsius or Fahrenheit, depending on what they're asking for. You need to be able to do the calculation to convert back and forth. Okay. Documentation and record keeping, the master formulation record, compounding record, standard operating procedures, and ingredient records. These are just some key terms that you need to know and read through. They're kind of long, that they want you to know like what they are and why they're important. So you need to read about that. Diluents. All IV piggybacks and IVPs or intravenous preps are made of a base diluent. So this could be sterile water or saline, sterile saline. Those are usually the what's it called, base diluents. Okay. And then PPI is a product package insert, and it will have the compatible diluent listed. Okay. So when you're like getting ready to make it, it'll show you on the product package insert from the manufacturer and tell you like what you need to make it, like the ingredients. Okay. Bud dates or beyond use dates. They are manufactured products, manufactured products, they have an expiration date, but compounded products have a bud date. Okay, so PPI, which is that product package insert, includes information on specific dates of a product. So a useful reference for this would be the Handbook of Injectable Drugs. So let me just kind of explain this in better terms for you. Basically, when you get a powder that comes from a manufacturer, it may have a 2-year shelf life. Okay, usually a powder is pretty stable, so it's going to have a long time. Even like a pill, usually they last a long time. But if you guys know this, that once you go from a powder to a liquid, that medication, sorry guys, some water. That medication becomes unstable because you change the composition of the medication. That's okay, but it now is not a 2-year shelf life anymore, right? It's all of a sudden might be a 2-week shelf life in the refrigerator, or, some of them are only a few hours. So you have to make sure that you know what that shelf life is. Okay, so open needle or punctured multi-dose containers have a bud date of 28 days. Anything non-sterilely prepped with water is 14 days. Okay. I am kind of worried. I heard a noise. I'm like, hold on, you guys. I'm worried that this stopped recording me. Okay, wait, it's still recording. Okay, good. I don't know what noise I heard, but okay, I'm gonna go back to this. Sorry. I know this is long, guys, but it's really important that you guys know this. So on a compounded product label, this is all the stuff you're going to need: patient's name, pharmacy information, prescription date, prescription name, date, compounded medication name and all additives, including diluents and volume, directions, pharmacist and pharmacy tech initials, and the bud, the date and time. Sometimes it has a time on there because some of them only last a few hours. So that's kind of important. Okay. Unit dose packaging or blister packs. This is used a lot of times for long-term health care facilities like nursing homes or skilled nursing facilities or hospitals where patients are there for a long time. Patient medications are put in cards with individual dosages for easier or more convenient administering, and helps patients with compliance and staying on a schedule. I'll give you the easiest example is birth control pills. They come in a pack of usually 28 days, and you pop them out, and that's why they call them a blister pack. And they usually have the whole month worth, and they'll have like Sunday, Monday, Tuesday, Wednesday, Thursday already on there. And they come that way. But some places, some pharmacies actually will put all of the patient's medication for the day in a pack by itself. And that just helps a lot of the times with nurses who are giving the patient the medication, or the patients themselves, if they're taking them, they'll remember they took it this day. So that's just an example for you guys to be able to visualize what that is. Okay. Unit dose systems, read pages 120 and 121. I don't know what that is in the online version, but just make sure to go through and read about unit dose systems. And you just need to know the proper documentation and how it differs from other kinds of prescriptions. Okay, and that is the end of this, okay? Let me see if I want to go through this because it's kind of long. We'll go through this actually in probably the next, is 7 and 8. We'll go through that in the next PowerPoint for the 8th module. So we're almost done with all the modules, you guys. These last two are like a lot of information, but we will get through it. Thank you for making it through this long. I know it's kind of slogging through. Make sure you go through the module and take the module quiz. And yeah, I will talk to you guys later. Bye.